We're going to take blood pressure. In order to do so, the patient needs to be rested for 5 minutes, and she needs to refrain from nicotine or caffeine prior to the assessment. Her arm needs to be supported on the desk or at heart level. Her back needs to be supported, and her feet need to be parallel on the floor, not crossed. It's important also to have the correct cuff size. When you wrap around the patient's arm, if the cuff hits here, the cuff is too small. And if it cuts onto this side, it's too large. This one is about the right size for her. You're going to place this arrow on the brachial artery and this side on the limb side. You're going to palpate for her brachial artery, and you'll feel the pulse. So it's right about there, and you also want to lift up their shirt so you're taking the measurement on bare skin. You want to line up the arrow with the brachial artery after palpating and wrap it semi-tight. You can place about 2 fingers in there. You're going to grab the pressure gauge and you want to place it right about here so you can watch it while you're measuring it. This is the bulb and the valve. You want to turn the valve clockwise or to the right so you have pressure when you're measuring. Then you're going to grab your stethoscope, and you want to make sure the earbuds are facing away from you. That way they're placed inside your ear. Then you're going to use this side of the diaphragm. You want to tap on the side of the diaphragm so you know that it's on. You want to place the diaphragm against the brachial artery. So you want to palpate one more time so you make sure you're measuring correctly. And you want to place it with your index finger and your middle finger. That way you don't get the pulse of your own thumb. You want to move these out of the way so you don't have any obstruction when you're pumping. Make sure it's tight and start pumping to about 180. You want to release the valve between 2 and 5 millimeters of mercury. And you want to listen for the first Korsakoff or lub-dub sound, which will be your systolic. So it's right there at about 120 or 118. And you're going to keep on listening as the Korsakoffs dissipate. The last one is going to be your diastolic, and it's right there at about 70. Once you hear the last one, you can release the pressure, and then you would check your normative values for blood pressure classification. And for a normal person, the systolic would be less than 120, the diastolic would be less than 80. For prehypertension, systolic would be between 120 and 139, diastolic would be between 80 and 89. For stage 1 hypertension, systolic would be 140 to 159, and diastolic between 90 and 99. For stage 2 hypertension, systolic would be greater than or equal to 160, and diastolic to greater than or equal to 100.